Dementia Researcher with a blogger narrating.
When you hear the word dementia, it's common to think about the symptoms from a few different angles. You might think of the mental side of dementia, loss of memory, confusion, and hallucinations to name a few. It's possible that you also consider the physical aspects of the disease, like appetite and weight loss. Perhaps you'll also think of the biology that underlies the progression of dementia, the buildup of toxic proteins and subsequent loss of brain cells and matter. The one thing that you're not likely to think of is the mechanical side of dementia. It is not really widely publicised, but it is definitely something that is observed in dementia patients. So what do I mean by the mechanical effects of dementia? I'm referring to the mechanical properties of the brain, specifically how stiff it is. Every tissue in our body has a defined stiffness. Bone, for example, is classified as having high stiffness because it is very strong, firm, and can withstand high impact. It has to in order to be able to carry out its main functions of keeping us upright and protecting our much softer vital organs from impact damage. In contrast, the brain is an extremely soft and fragile tissue. That's why our skulls are so thick. We need to protect our brains from damage. Tissue stiffness is very closely controlled in our bodies, and the cells embedded within our tissues are as much in control of tissue stiffness as they are controlled by it. This is one of the many properties that in our bodies is regulated by an intricate and elegant balance of homeostasis. Any healthy patient should be exhibiting tissue stiffnesses within the normal range. Certain diseases have, however, been shown to correlate with a change in tissue stiffness. Many cancers, for example, result in an increased tissue stiffness as the tumour cells grow and remodel their environment to become more tumour-friendly. In breast cancers, it's common to see fibres of collagen become dense and more aligned, and that results in an increase in breast tissue stiffness. Interestingly, medical evidence is now also pointing towards dementia as being another healthcare issue that results in changes in tissue stiffness. However, the picture is a little bit more complex than as simple as the stiffness is always going either up or down. It appears it depends on what dementia-causing disease is persistent in the patient. In Alzheimer's, for example, the brain is often seen to become significantly softer than normal. That's perhaps not surprising given that Alzheimer's results in the death and loss of brain cells and tissue. You'd expect the brain to become mechanically weaker as a result. Conversely, in dementias with an integral vascular complication, many studies have shown that the blood vessels within the brain actually become stiffer as they become more hypertensive. Either way, these changes in stiffness could provide ways of diagnosing dementias earlier than we can now. Normally, a patient is not diagnosed until the neurodegenerative mechanisms playing out in the brains become advanced enough to manifest as physical or mental symptoms. At this point, a considerable portion of the brain has already been lost. Being able to screen for more subtle changes in brain tissue stiffness could alert medical professionals to early signs of dementia progression, allowing therapies to be administered before large-scale damage is done. This would have a major impact on the lives of dementia patients. So I guess the big question is, how do we go about screening for it? Normally in a lab, if you want to probe the stiffness of a material, you have a range of equipment to use from rheometers, compression testers, and different types of microscopes. However, you can't really cut someone's head open and take a sample of brain tissue to measure the stiffness and determine its health. It's a bit counterintuitive. It turns out the answer lies in something that is used in hospitals every day. Magnetic resonance imaging, or MRI, is commonly used to examine tissue health and is a key diagnosis tool for dementia. If MRI is combined with low-frequency vibrations, it allows practitioners to get an elastic map of a tissue. The process is called magnetic resonance elastography, or MRE, and it can detect regional changes in brain stiffness without having to cut a patient open. It's a powerful tool and could have a big role to play in improving the speed and accuracy with which we diagnose and treat cognitive impairment. I'm definitely not saying we should drop everything else and just focus on this, but with so many questions still remaining about how we can better understand and treat dementia, why not use all the tools we have? Tissue stiffness changes are one of many manifestations of dementia. It is good to see it being given the consideration it warrants in the ongoing discussion about how we can fight to eradicate neurodegeneration for good.
Thank you for listening. Join the Dementia Research bloggers and share your own views.